immune system balanced to get their body detoxified. But they need to hear that. It's so important to get in that person's head because
on the greens?
yes, because they need to get about living instead of get about dying. You know, doctors too often get people into a prayer of agreement in the wrong direction. Like they suggest things and then people go. And because they got a white coat on, they accept it and they start down a path they don't want to go down. So don't get into a prayer of agreement with your doctor. Get into a prayer of agreement with your pastor and your creator. You say, I'm strong, I'll be healthy in the future, I'll not die but live, I'm going to be this thing.
I have two questions. One, if you're already regular, is there a need to take the regular?
Good question. If you're already regular, is there a reason to take the regular? No, I'm already regular, 2 or 3 vitamins a day, but I take one once a week just for maintenance because I want to keep the wall of my colon clean, and there's certain herbs that are pH balancing in there that will help things from accumulating. When you have an autopsy, a normal colon should weigh about 12 pounds, and I'm told that John Wayne's colon was 60 to 70. It's just toxic. You know, there's a thing called toxic megacolon. It's just a loaded up colon filled with blood that should be cleansed naturally every day.
My other question is, I know a child with autism. Is there a benefit to, of course, vitals and greens, and if so, doubling on any of those or any?
Autism, yeah, I definitely would recommend the vitamin greens, and doubling them would not be a bad idea. Autism, lots of theories out there, as you all know, and I'm not a big fan of vaccination. I did not vaccinate any of my children. They're from 6 to 13. They got no vaccinations beyond 0.
Wow.
And they're healthy, they're strong. They get maybe 1 or 2 fights of colds a year, acquiring immunity. Here's my reasoning on that. But you do what you want, do what you have peace about. I'm not recommending this. I did my research, and I was scared when my 13-year-old was a newborn, and we had to face that whole issue. And I'm the doctor, I was trained to have to, you know. Here's the thing. Immunity should be gained by breathing in or eating foods, and that's why over 70% of the immune system is along your GI tract, because that's really outside your body. Until things are absorbed, they don't get into your body. Your food tube or the tube that's outside your body. That's why the road to health is paved with good intestines, right? But you're supposed to be exposed by eating things that may have some toxins in them, by breathing in toxins, and your body has a chance to assimilate, get exposed at a slow, steady rate to mount an immune response. And then what we come along with immunizations, we skip that and go right into the body, directly into the bloodstream potentially. And so we skip that first level. The other one says, ask your doctor who's doing vaccinations, can you guarantee that my child, if they get vaccinated against this, you know, DPT, diphtheria, pertussis, tetanus, can you guarantee they won't get D, P, or T if I vaccinate them? And then they'll say, they cannot say it, I can't guarantee it. Then you say, if I do vaccinate them and they do get D, P, or T, is it worse for them than if they weren't vaccinated, or worse if they were? They have to say, worse if they were. Based on those things, I decided to let my children acquire immunity naturally. But it's not a deal breaker. If someone just doesn't have comfort with that, there's a reason. If you do the studies on vaccination, you find out most of the major things that are vaccinated against were already coming down before the mass vaccination came into being. So they kind of the vaccinators rode that train that was already self-limiting. So that's just I'm just not a vaccinated fan. But if you're not going to detoxify the child, balance their immune system, and give them nutrition and raise them right, then maybe you better get vaccinated. I knew what I was going to do, so that's my story, and I'm sticking to it.
I have a question about breastfeeding mothers. All right, is this safer than the last? Is it releasing toxins into their system that they don't feel much now?
For pregnant and breastfeeding, we just have to recommend, and what your obstetrician gynecologist would say, nothing. You know, as little as possible, no medications, no anything. So technically, that's how I have to answer that. However, my wife did her vitamin, greens, and nutrition before, during, and after breastfeeding all of her children.
But wrapping.
And wrapped. But, you know, here's my philosophy on that. When you feed the baby needs the fat, needs good milk. You know, don't get so obsessed with getting skinny while you're breastfeeding, girls. You got plenty of time for that. Feed that baby. That's just an opinion.
Did you say you can wrap while pregnant, but maybe not your abdominal area?
No, don't wrap while pregnant or breastfeeding. That's what I said. Now, I did say that my wife did. And I don't know of any contraindication, but you know, just stay safe. And girls, you're trying to make milk. Don't try to get so scrawny. If you try to get, you know, don't eat while you're not going to make good milk. Come on, feed your baby. Forget about your shape for a few months. Can you just take a chill pill?
Dr. Don,
Yes,
I have several loyal customers that are thinking that are on the HCG diet and they want to wrap and just wanted to get a clarification on that.
Yeah, no contraindication to wrapping on the HCG diet. No contraindication. They can wrap.
I have a question. My sister had her stomach removed due to a condition that she had. What products to use for
Stomach removed. Okay, now for her, because she doesn't pre-digest things before they empty into the small intestine for absorption, she really needs help with digestion. So she needs enzymes. Now there are enzymes in the greens, so I recommend that. And she's probably not getting the nutrients out of the foods that she needs because minerals take a lot of acid to be absorbed, and she's got her stomach missing. She's not getting minerals, and she needs vitamins. She needs vitamin greens, but because she doesn't have a stomach, I crush it up and take a smaller amount more often. She can probably take a full 2 scoops of greens and 2 or 3 vitals, but she should spread it out a little bit throughout the day. Question?
A fat fighter for diabetes. How do you recommend them how to take that?
Fat fighter for diabetes. Fat fighter is, I think on the label it'll say something like take 1 or 2 with your highest fat meal. If you're using it to feed the pancreas to help balance the blood sugars, to give them and gymnasium, chromium, and other things in your fat fighter help, I probably take 2 twice a day. And don't forget the vital, because there isn't vanadium in the fat fiber, and vanadium is really important, and it is in the vital. And we're putting alpha-lipoic acid enhancing the vital with that, which is extremely important for that picture as well. Soon to come. You didn't hear that from me. I take it back.
Okay, we're going to have to stop here so we can go for lunch.